The English Nurse by Professor Charles Lane Olmsted. Chapter 4, The Body, a Gimcheon University presentation. Vocabulary: artery, artery. Veins, veins. Capillaries, capillaries. Epidermis, epidermis. Muscles, muscles. Tendons, tendons. Ligaments, ligaments. Joints, joints. Blood, blood. Platelets, platelets. Bone marrow, bone marrow. Nasal cavity, nasal cavity. Spinal cord, spinal cord. Lymph node, lymph node. Adrenal glands, adrenal glands. Septum, septum. Urethra, urethra. Pituitary gland, pituitary gland. Cornea, cornea. Retina, retina. Lens, lens. Parathyroid glands, parathyroid glands. Eardrum, eardrum. Cochlea, cochlea. Ovaries, ovaries. Uterus, uterus. Prostate, prostate. Prefixes, suffixes, abbreviations. Derma or dermat, related to the skin. Dermatology, study of the skin. Lymph, lymph vessel. Lymphedema, tissue swelling caused by accumulation of fluid. My or myo, related to the muscle. Myocarditis, inflammation and damage of heart muscle. OCUL, eye, oculist, doctor who specializes in treating diseases of the eye. ATRICS, relating to medicine. Pediatrics, medical care of infants, children, and adolescents. Sentence patterns. He pulled a muscle playing soccer. He pulled a ligament playing soccer. He pulled a tendon playing soccer. With a hit like that, you were lucky you didn't damage your spinal cord. With a hit like that, you were lucky you didn't damage your cornea. With a hit like that, you were lucky you didn't damage your retina. With a hit like that, you were lucky you didn't damage your eardrum. Many people donate blood. Many people donate platelets. Many people donate bone marrow. The doctor will check your prostate. The doctor will check your nasal cavity. The doctor will check your lymph node. The doctor will check your uterus. The parathyroid gland is inflamed. The nasal cavity is inflamed. The eardrum is inflamed. Sentences. Men over 45 years of age should get a regular prostate exam. Injury to the spinal cord usually means paralysis. I had cornea transplant last week, and I get the other one in 2 months. Bypass surgery is when they cut a section of artery from your leg and put it near your heart. Arthritis runs in my family, so my joints are already hurting. An Achilles tendon popped, so I am using a cane now. I like drawing blood because I can hit that vein every time. They stuck a needle in my lens to draw out fluid. My sister is going into the hospital tomorrow to have her ovaries fertilized, as she likes to say. There is no damage to the eardrum, but it will be ringing for another day or two. You have 4 parathyroid glands, and one is inflamed, which offsets the others. The circulatory system consists of arteries, veins, and capillaries. He retired from boxing because he got a detached retina in his last fight. A bone marrow transplant can help people, and it's easy. It takes about 2 hours to donate platelets. She is in great pain because more than half of her epidermis was burned. He thought it was a pulled muscle, but he tore the ligaments in his leg, so he is out for a month. The baseball cracked his cheekbone and almost damaged his navel cavity. The adrenal glands control your heart rate and blood pressure. Even though the pituitary gland is about the size of a pea, it has several functions. His deviated septum causes him to snore. Your lymph nodes filter out infections of viruses and bacteria. My uncle had a cochlea implant to improve his hearing. Mother has endometrial cancer, so they will remove the uterus. It's called a hysterectomy. You have an inflammation of the urethra, and that is why you're in pain when you urinate. Conversation A between doctor and mother. He's okay. He just pulled a muscle. That's all? The way he went down, I thought he had broken something. Nope, the bones are as solid as ever. Just a pulled calf muscle. That doesn't sound too bad. No torn ligaments or anything? Ligaments and tendons are fine. Just stay off it for 5 days and he should be okay. Anything else he should do? Keep his leg elevated and put an ice bag on it. Does he stretch before? Probably not. They are teenagers. He should stretch before every game and just a little during if he sits for a long time. He has a game Saturday. He should be fine. Questions. What was the diagnosis? What does the doctor recommend before every game? How long should he stay off his feet? Discussion. Why is it important to loosen up before a game? Have you ever pulled a muscle playing sports? How was it? How long did you heal? Rice treatment for injuries. An easy self-help treatment for simple sprains and strains is the RICE method. It is for rest, ice, compression, and elevation. It helps reduce swelling, prevent further damage, and promotes healing. Taking an ibuprofen or some other non-steroid anti-inflammatory medicine should reduce swelling and pain. The RICE method should be done as soon as possible after the injury. It is important to keep any weight off the injured area for 48 hours. You should apply the ice for about 20 minutes every 4 hours. Be sure to have the ice pack wrapped with a towel. Conversation B between doctor and nurse. It would be much easier being the team doctor for a ping pong team. Do they have many injuries? That's the point. The doctor for boxing, though, stays busy. It's just amateur boxing. They wear very padded headgear and gloves. It's still professional injuries like detached retinas, broken nasal cavity, and busted eardrums. I hear women are getting into boxing too. Great. There will probably be ovaries and injured uteruses to worry about. And bloody noses and eyes too. My son will stick with swimming. I treat more bloody noses in 1 week in boxing than I do for 2 months in ER. Those padded gloves don't help much. They do. Half of the bloody noses and deviated septums are the fans. What are some of the injuries in boxing? What sounds like the biggest medical problem? What are some injuries you might see at other sports. Moving the body. Tendons, muscles, ligaments, and joints are all part of the muscular system, and all with their own purpose. Tendons and ligaments are both strong and consist of dense connective tissue. Tendons connect muscle to bone. They are white fibrous connective tissue and are at the end of muscles. Ligaments are yellow fibrous connective tissue and connect bone to bone. There are more than 600 muscles in the body. There are 3 types of muscles: skeletal, smooth, and cardiac. The skeletal muscles are attached to bones and give the body shape. The voluntary muscles control our movement, whether walking or lifting things. They can work for long or short periods of time, and quickly or strongly. They have to rest occasionally. The smooth muscles are controlled by the nervous system and are always at work. They are the walls of the stomach and intestines and help move our food through the digestive system after breaking it down. They are also in the blood vessel walls and help contract blood through the system, giving us blood pressure. The heart is another involuntary muscle as it pumps blood. The 4 heart chambers are composed primarily of muscle fibers. There are 6 types of joints in the human body: ball and socket, hinge, gliding, saddle, pivot, and ellipsoidal. Joints allow the body to move. Joints in the skull do not move. The hinge, knee and elbow, open and close like a door. The head has a pivot joint which lets you move in a rotating fashion. Your hips and shoulder have ball and socket, which allows for much greater movement. Questions. What are the 3 types of muscles? How many muscles are there in a body? How many types of joints are there? 4. What connects bone to bone? 5. What connects bone to muscle? 6. What kind of joint do you have on your knee and elbow? 7. What kind of joint do you have on your hips and shoulders? Did you know? Physical therapist. Physical therapy is a growing field as more baby boomers seek medical attention with their active lifestyles. Actually, physical therapists have been around for years, helping people of different ages with a variety of problems. Their patients are not just athletes. Their clients could be the young mother who just gave birth, the war hero who lost a limb in battle, or the person who needs to relearn how to walk after a stroke. The physical therapist will examine and assess your situation, plan a treatment, and then guide you through the treatment. They will work with doctors and caregivers as your recovery takes a team approach. The goals vary for each patient. Besides relieving pain, the goals are to improve movement or ability, recover from an injury, adapt to an artificial limb, prevent disability or surgery, work on balance, recover after giving birth, get a splint or brace, control your bowels or bladder, and manage a chronic illness or disease. At the first meeting, the physical therapist will ask many questions to determine the right course of treatment. They want to know how well you can move and function, how well you walk, your balance, and your heartbeat while active and at rest. From the information plus your goals, the therapist will map a course of treatment that may include exercises or stretches, massage, heat or cold therapy, or ultrasound to ease muscle pain, practice with gadgets to help you move, and how to use an artificial limb. Therapists work in hospitals or clinics, sports medicine clinics, doctors' offices, assisted living and nursing centers, offices, and in individuals' homes. The therapist may also give you exercises to work in between visits. Questions. Name 3 groups of possible patients and their problem. Name 5 functions a patient may use the services of a physical therapist for. 3. What are some possible treatments? And that is it for Chapter 4. Thank you. Bye.